conversation online and be a part of WCTC's real-time talk. Like 1450 WCTC on Facebook and follow us on Twitter at 1450 WCTC. Jersey Central with Bert Barron.
Think we could listen to the radio or something?
On the new Talk Radio 1450 WCTC.
It is 8:09. Welcome to hour number 3 of Jersey Central on the new Talk Radio 1450 WCTC, the voice of Central Jersey. It is Bert Barron. We're inside the Forge Jeweler Studios today. Great to have you with us, and we're going to have our contest very shortly. I've got your chance to win a family 4-pack of tickets to see the Nutcracker, American Repertory Ballet, bringing the show to State Theater, New Jersey on December 16th, and you'll have a chance to win coming up. All right, so we'll do that very shortly. Some good news, some exciting news that will bring hope to children with a very rare disorder. And this is courtesy of the Northeast Regional Epilepsy Group to talk about a new study that may bring hope for kids suffering with a rare form of epilepsy. And my guest on the Jersey Central Newsmaker Hotline is Dr. Eric Segal. He is the director of New Jersey Pediatric Epilepsy to explain some of the details and why this is such great news for us. Eric, good morning. It's Bert Barron. Welcome to WCTC. How are you?
Good morning, Bert. I grew up in North Brunswick. This is my mother's favorite radio station.
Well, you tell Mom that she's a fantastic mother who raised her son right, and thank her for listening to WCTC from me, okay?
I'll let her know.
Excellent stuff. Thank you. Talk about why this is such an exciting news, and this is bringing hope to a lot of people. Eric, talk about that.
Absolutely. So, 10% of the population can have a seizure, and about 1 in 26 of the people in the U.S. will have epilepsy. But a much smaller group can have something called Dravet syndrome. Now, Dravet syndrome is a very rare form of epilepsy that typically begins early in life and can be very difficult to treat with our conventional therapies. So there is a new therapy out, a new medication called fenfluramine. Actually, isn't so new. It's been studied since the 80s in patients with epilepsy in Europe. And for this particular population of children with Dravet syndrome, it's shown to have remarkable results. So what we're hoping to do is we are studying this medication here in the U.S. to see if we can replicate these results and to see if this therapy can bring significant reductions in seizures to a patient population that severely needs it.
Yeah, so this is, and there's a lot of things that have happened with regards to this. And I have a very good friend, Eric, who lost his wife very, very early in life. She was in her 20s, epilepsy, actually drowned. I think it was in a bathtub or something, suffered a seizure and ended up dying at a very, very young age. So any news that comes along from this that I think is going to bring some people hope, particularly for children and for young people, I think is pretty exciting.
I'm so glad you mentioned that. About young adults between 20 and 40 with epilepsy have more than 20 times likely chance to die a sudden death than the general population. The epilepsy and sudden death in epilepsy can be so dramatic, and for patients with Dravet, there's even a higher risk of this. So this medication is not typical. It's not conventional like the other anticonvulsants that we have. But we hope by utilizing some of the neurotransmitters in the brain with this medicine, we may be able to help this population and prevent these tragic losses of life that occur way too frequently.
Yeah, our guest this morning on WCTC is Dr. Eric Segal. He's the director of New Jersey Pediatric Epilepsy. Both at the Northeast Regional Epilepsy Group is where he does his work from. And this is pretty exciting news with regards to this here. Is it a collaborative effort, Doctor, between hospitals and experts and it's sort of an all-hands-on-deck sort of approach when it comes to working on things like this and developing therapies and treatments and medications and such?
Oh, absolutely. This is really a effort that is being performed through multiple centers throughout this country, and we are really hopeful and excited that this may work. If there are families in the area that would like to access our study or others, they're welcome to check out our website, which is www.epilepsygroup.com, and there listed we have the different clinical trials that we're performing, and this one we're especially excited about as we think that this may really be able to provide such a strong benefit to so many people.
Yeah, and this any breakthrough, any good news, I think that comes about, Eric, when it comes to epilepsy, is something that's really welcome with a lot of people. I mean, it's such a hideous thing that someone has to deal with this. anything that can come along and give some people some hope or give some people some relief or some peace of mind, I think is a tremendous thing. It really is. Aside from this and what you're telling us about today, Eric, anything else on the horizon that you're excited about? Anything else in the future that maybe we should keep an eye on that might even take this to another level?
Yeah, so I would say that there's several different things that we're looking at. So going back to what you originally mentioned about that tragic story about your friend's wife, there's a lot of different technologies that are being developed that are looking at ways to be seizure detection devices, such as especially utilizing the smartwatch technology in a way that if a person, God forbid, has a seizure, then that watch linked to someone's cell phone can call an emergency contact list, for example. So we feel more comfortable about our friends and family who have epilepsy that can be left alone. In addition, there's other sort of bedroom monitoring devices as well. In the world of diagnosis, there's been huge advances in the world of genetics, and especially with Dravet syndrome, like we're talking about here, where we have identified a gene, we have identified an animal model for the gene, and that can further propel us to making new strides in drug development for this patient population. So those two areas are really exciting. And then finally, in terms of therapies, there are always new medications coming out, and we're very happy to see drug companies thinking outside the box. So fenfluramine is an example. There are other companies that are using other complementary alternative medicines or even repurposing other medications to see if they can be effective for the treatment of epilepsy. So thank God the world of neurology and the world of epilepsy care in general is making huge advances, which is a big deal because seizures can occur at any time, anywhere, and it can be devastating to those, especially when we're not around to help them.
Yeah, this is remarkable news. Before we wrap up, Eric, can we have that website again where people can go for more info?
Absolutely. So the website is www.epilepsygroup.com.
Excellent stuff. Dr. Eric Segal, our guest here on Jersey Central, the director of New Jersey Pediatric Epilepsy, local guy from Central Jersey. And please thank Mom for being a loyal WCTC listener, Eric, and it was great speaking with you today, okay?
My pleasure. Thank you again.
You bet. Thanks a lot. All right, there he is, my guest, Eric Segal, Dr. Eric Segal, director of New Jersey Pediatric Epilepsy here on